Hey guys, Don here. Welcome to Podiatry Practice Mastery. We're going to go over what brings your office to the $1,000,000 mark and beyond. Um, I'm going to go over these patients here. This is a recording for a Wednesday. So first patient was a plantar fasciitis patient. He had number 4 out of 6 on Shockwave on his left foot. I'll be back in a week for the next one. Next patient was a 56-year-old patient. Got a ankle sprain, did x-rays, and kind of evaluated that for the patient, and I gave different types of exercises for him for strengthening, and to give some Celebrex and to try to calm down things, and then he'll be back in a couple weeks for evaluation. Next patient was a 70-year-old. She was probably one of the MVPs of the day. So she had bilateral Achilles tendonitis. She got bilateral night splints. And she didn't want to start with Shockwave, but she wanted to start with physical therapy and like the foam rolling and everything else like that. So she didn't. So she's going to start that first, and then what I tend to find is at the follow-up, when it continues to be painful, she'll be doing Shockwave. But I kind of prepped her for Shockwave. Next patient was a 65-year-old female. She is Shockwave 1 out of 6 for her metatarsalgia. She has it on the second and third med heads. So we're doing this bilaterally on her second med heads. So this may be kind of another MVP patient as well because of that type of Shockwave. The next patient was a 59-year-old patient. I can't read my writing. I think he's here for an orthotic follow-up. Okay, this is what it was. He was here for an orthotic follow-up, and he wanted a second pair. So we ordered him a second pair of orthotics. When patients get my orthotics, they get a little paper in there that says $200 off the second pair. So he would only pay $400 for the second pair of orthotics, but it really takes no extra work on our end. Next patient was a 60-year-old male. He had some right Achilles insertional pain with kind of a bone spur. I had seen him previously. This gentleman, he was looking really good. He was on Ozempic or one of the other similar weight loss medications, and his Achilles was bothering him. And he saw a group of physical therapists that did 6 sessions of foot. I think it was Softwave for him, and he didn't really see much improvement with it. And he wanted to consider surgical. It would be like the speed bridge procedure. So it's hard when someone comes. I don't know how other people do Shockwave, so they probably did it correctly for the 6 sessions, because usually if it's not better after 6 sessions, he's just fed up and he wants that out. But that's a big procedure. But it's hard to. Are you going to have them do another 6, and then potentially delay that 6 weeks plus 6 weeks for the follow-up, which would be 12 weeks, which is 3 months. And this guy's in pain. So in his case, he's gonna be having a heel spur surgery, so a speed bridge. Next patient was a 53-year-old female for nail fungus follow-up. She had failed terbinafine. She did better with diflucan, so I put her on another round of diflucan. Next was a 75-year-old male that came in for a Lamisil booster. Once again, they usually get the first round of terbinafine for 3 months. And if it's clearing out, then I give them a booster dose. Next patient was a 55-year-old that came. She had seen a sports medicine doctor, had some ankle pain, was sent to PT for a number of sessions, and the PT sent over to us for a evaluation. And I saw a possible talar dome lesion in the lateral talar dome, and we're going to get an MRI for this patient. Next patient was an 82-year-old. This gentleman, he came all the way from Boston, which, I don't know, it doesn't seem that far, but it was quite a distance for him because he saw us online, and he had Achilles tendonitis, insertional, got an x-ray, got an ultrasound. He has been going to PT for years and just never got better. He had, probably 4 years back, he had some Shockwave, and that's what I think he would benefit from. He didn't want to do it. I'm not sure why he didn't want to do it that day, but he said he wanted to talk to his physical therapist. But I think he would benefit from 6 sessions of Shockwave for him. Next patient was a 56-year-old female at Cariflex. She got 1 Cariflex toenail, done. Next was a patient, 82-year-old female, that was concerned about nail fungus, and we did a nail sample for her. Next patient was a Qutenza patient, so we did a Qutenza on him. This is Qutenza, I think it's number 2 or 3 for him. Next was a 58-year-old female that had a right ingrown toenail that I did a slant back. So with slant backs, the way I understand it, I just do an office visit. I can't really bill that because I'm not numbing up the toe, but I did put an AniFix on the other left hallux for her. So I tend to find that AniFix, I don't do a ton of AniFix, but I find it works better if the nail's flatter at the base and curled towards the distal tip, and that tends to work okay. And I have them come back whenever the AniFix comes off. Next patient was EPAT number 1 out of 6. So this is a guy that I think I told you recently. He is an engineer, and he had watched all my videos, and then I sent him more videos on plantar fasciitis, and so he knew exactly what to expect for the Shockwave. He even knew like the settings and everything like that. Next patient was a plantar fasciitis patient. Got X-rays, got ultrasound. He did not have as much plantar fasciitis. He had only plantar fasciitis on the left side, so I gave him a night splint, and he brought in his wife, so his wife was there as well, so I saw his wife. She got orthotics, and she also had some plantar fasciitis, but hers is mostly from being on a hard surface standing all the time, so I think orthotics are going to be the best thing for her. For him, he has a little bit more pain, but he has a very sedentary job, so I think both of them are due to tightness. And then the last patient was a patient that came in, just had an ingrown toenail question, kind of a quick visit. So that was the day. Things are getting better with ModMed. We're still kind of dealing with some communication issues. Like it's hard to say, for example, if a patient gets, they want like a cream, or if they want to purchase things through the clinic. Sometimes it's hard to put that in. You can put in like self-pay things, but then if they don't buy them, it's kind of an awkward position of how to recommend things. And because if you put it in the note in the follow-up, it doesn't really, it kind of pops up in the note, and I don't want it to show up in the actual note that's going out there. So I'm still trying to figure out ways for communicating. We're also kind of dealing with the faxes. Our faxes aren't going through, so we had a kind of a struggle with that. And then we finally decided, I think they answered all the phones. We're having a phone issue in our office. So I'm just kind of letting, I always like to let you know the good, bad, and the ugly. The phones, there's just too many calls, which is a good thing to have. But if they're not being answered, I think they're probably calling other places, right? If they're going to voicemail, they want to get answers. So I think they're doing a better job. I think the challenge was like changing the EMR and then having them also answer the phones. It was just a big change. We are looking into getting a virtual assistant to help with some of the phone answering and some of the tasks that need to be done, like prior authorizations, checking on insurance, scheduling patients, going through all the faxes, everything else like that. So we are going to be onboarding someone else for that soon. The benefit to that, I think, I was looking at the prices, I think it's like $14, $16, and $18, depending on what they do. If the more things that they do, the more they get. But the benefit to that is like there's no taxes, right? You just pay them. This particular group is from Colombia, and they speak fluent English in that area, or they say they speak fluent English. But so I'll let you know how that goes when we do that onboarding. But other than that, things are kind of calming down a little bit. We're still kind of seeing some improvements in this new EMR. It's getting a little bit easier, a little bit less painful. So that's about it. Okay, until next time.